Amon-Ra St. Brown, wide receiver from the Detroit Lions, suffered an ankle injury against the Green Bay Packers on Thanksgiving Day. If we take a look a little bit closer at what happened here during the play, it's kind of hard to tell exactly where or what happened to that ankle. However, our mindset might go to more of a sprain in the ankle, so we're going to go over some of the options of what could be going on with Amon-Ra St. Brown. Here's our anatomical model, and this is where we're going to go over some of the structures that might have been involved with Amon-Ra St. Brown's injury. First, we have our lateral ankle stabilizers here. These ligaments help stabilize a typical ankle sprain. The first one we have is our anterior talofibular ligament. This is the most frequently damaged. Then we have our calcaneofibular ligament seen in the middle. And then we also have our posterior talofibular ligament seen back here. A few structures that could be involved is potentially for a high ankle sprain. We have both our tibia and fibula seen right here and connected. You have this interosseous membrane between the tibia and fibula. You also have other ligaments that help stabilize, like your anterior inferior tibiofibular ligament seen over here. As well as back here, we have our posterior inferior tibiofibular ligament. So with the lateral ankle sprain, with those lateral ligaments, as we discussed earlier, typically the mechanism of injury is that rolling motion, and there's that combination of inversion of that ankle as well as plantar flexion, which is that typical mechanism of injury for a lateral ankle sprain. And then for a high ankle sprain, we have that interosseous membrane and those other ligaments that help support and prevent this from happening. The common mechanism of injury is that extreme external rotation of that lower extremity as well as dorsiflexion of the talus. If it ends up being more of that lateral ankle sprain, it's just a low-grade ankle sprain. He could just even miss just 1 or 2 weeks. However, if it ends up being more of that high ankle sprain where that interosseous membrane is involved, he could potentially even miss to 4 to 6 weeks.